Hello, my name is Thomas, and this is my last remediation video. I have done 85 questions on Kaplan, and I've done 30 questions on UWorld. So the first question is the preoperative nurse plans to have the client sign a consent form for today's surgery. After looking at the client's record, the nurse realizes that the client receives my midazolam 15 minutes ago, which is the appropriate action for this nurse to take. When reading this, we know that midazolam is a sedative, so the answer choices are: have the client sign the form now because it is too soon for the medication to have taken effect. Ask if the client feels drowsy or confused. Have the client sign the form if the client's Glasgow Coma Scale score is 15, or tell the healthcare provider that the client is unable to give consent at this time. For me, I chose that the client is able to sign if their Glasgow Coma Scale is less than 15. I just assume that if they score such a high number, they're oriented to self-place and are able to do it, to sign. But it's actually, you should tell the healthcare provider that the client is unable to consent, because we want to make sure that the client is capable and to understand that there's his options and what he's doing. So therefore, because of the midazolam, he is deemed not valid to give consent. Okay, and then the next question is: the community health nurse provides care to an older adult client who recently developed decreased hearing acuity. The nurse family is concerned because the clients insist on taking evening walks. Which recommendation by the nurse is best? Okay, and then the answer choices is: it is best for you to walk in the morning. Consider visiting an audiologist. You need to find a walking partner or carry a cell phone at all times. I thought um, it is best for the patient to walk in the morning, because there's, I don't know, mostly because in the evening you'll get too dark, and therefore they're prone for any injuries or risk for anything else. So I just assumed it'll be better for them to walk in the morning. But honestly, I should have chose the correct answer, which is consider visiting an audiologist. Mostly because the primary concern for the client is to promote a health and wellness. So therefore, he should visit the audiologist. Okay, and then I'm trying to find. I'm sorry. Oh, the next question is: a nurse precepts a novice nurse and reviews practice intended to reduce the incidence of accidental needle sticks injury. The nurse recognizes that which statement by the nurse as an indication that additional training is needed? The answer choices are: I'll use the unassisted one-handed technique to manually recap the exposed needle. It is important to maintain a sharps injury log for needle stick injury. Dispose of all needles in sharps container. I'll immediately get rid of the used needle after each use. I did not choose the correct answer because I thought you are able to do a one-handed manual recap of an exposed needle. I think I read that wrong. Because I know during clinicals, or not clinicals, but during lab, they taught us to just put the cap on the surface, and then you just kind of scoop your needle on the cap and then close it, instead of having the cap and then just putting it in. So that's what I thought, it was the one-handed technique, but in reality, it meant like just using one hand to recap everything. So yeah, these were the type of questions that I missed. I think it was honestly just the wording of the answer choices. So yeah, thank you.